Welcome back to the channel. Recently on Sensible Medicine, I wrote an article entitled, Yes, the U.S. Should Withdraw from the World Health Organization. Reuters last week reported that Donald Trump was thinking on withdrawing the U.S. from the WHO on day one of his new administration, and many people, the usual suspects, are all upset with that choice. Here are the facts. Number one, the biggest single funder of the WHO is the United States. We put in about $1 billion to this organization annually. We already have our own internal organization that deals with pandemics and things of that nature, the CDC, but we put money into the WHO for the greater good. The WHO, in return, promises to be a science-based organization. They have to use science to make their health care decisions. They're not supposed to get involved in political disputes. And if they do, it would make sense that the people who feel targeted by their political action would not want to fund them. So that enters the recent decision. I'm going to build a case in this video that the WHO, throughout the COVID-19 pandemic, failed in their duty. They were not a science-based organization. They, in fact, were a politically motivated organization. They made opinions seem like they were based in science when they were really just things that they believed in. Those opinions that they turned into recommendations were the opinions that were shared by people of a certain political persuasion, and they advanced a certain political agenda masquerading as science. So let's look at those. Let's look at those opinions. Number one, the WHO on lockdowns in 2020. Here's what they write. Quote, what is the WHO's position on lockdowns as a way of fighting COVID-19? Large-scale physical distancing measures and movement restrictions, often referred to as lockdowns, can slow COVID-19 transmission by limiting contact between people. Well, they got a bit of a problem there because we actually don't know even today if that claim is true, and they certainly didn't know it then. What we had seen in the 2020 COVID-19, in 2020 in the pandemic, was the most unprecedented restrictions that democratic governments placed on their citizens. Restrictions against travel, restrictions on visiting your loved ones who are dying in the hospital, restrictions against church gatherings and funerals that were enforced by the police state. That's the whole point of lockdowns. The government is telling you can't do that, and they will arrest you, detain you, ticket you if you do. That's the point of a lockdown. We learned that idea in Western societies from China, because China, of course, a totalitarian government, can weld people into their buildings. But the United States and European nations typically don't do that because we are free democracies. Now, people who support this policy claim it saved lives. There's actually very little evidence to support that claim. I will make the argument, I think, that the harms outweigh the benefits of lockdown. I'm happy to make that argument. It's a longer argument, but let me come right to a very clear point. If you take two adjacent counties in the United States, one county happens to be in one state, the other county happens to be the other state, and one county has a lockdown and the other county doesn't have a lockdown, you will find in a number of empirical studies conducted in the United States that the actual mobility data, if you track people's cell phone movement, is actually quite comparable between those two counties. In other words, when the pandemic is spreading, people will turn to the news, and they'll see that fear-mongering coverage that people are getting sick and they're going to the hospital in some region. And when they see that coverage, when they see fearful news, they will change their behavior voluntarily. Lockdown, that's not lockdown. Lockdown is the government going beyond that and putting a restriction, using the police state, on movement. Now, if you see two adjacent counties, one has lockdown, one doesn't, someone might be tempted to argue, and I've heard some people do, that lockdown didn't even matter that much. People weren't going to move that much anyway, so it didn't really matter. It can't have harms, it can't have benefits, it didn't matter that much. But it does matter. It doesn't matter for the on-average case. It matters for the exceptional case. You see, when we look at mobility data, we're looking on average mobility. On average, there's a couple people going here or there. We're not looking at the exceptional cases. See, lockdown is not designed for the on-average person. The on-average person does what they think is most prudent based on the news coverage. Lockdown really restricts that person who says, hey, I know a virus is spreading, but to me, it's still worth it to go to church. Or, hey, I know that it's not a great time to go out right now, but for me, I need to go visit my father for some important reason. He's old, he's sick, he's infirm. Those people get to make those exceptional choices in the city within the region without lockdown. They don't get to make those choices in the other region. People who feel like they can't take it anymore in their house. Australia, of course, is notorious for having some of the most brutal scenes where the police state was imposed upon common citizens who were just trying to walk around and get a cup of coffee with a friend. So, my point is, number one, because of the mobility data, it is very likely the case the U.S. lockdowns had no beneficial effect because they did not change on average behavior at all. And because of the fact that lockdowns involve using the police state, it probably did have a negative impact on exceptional cases. In other words, it can only be a bad intervention. Now, the bottom line is, you don't have to believe me on lockdowns or not. My thesis is not that the WHO was wrong. It's that the WHO claimed to be a science-based organization, but they never actually used science. They cannot cite any study conducted by the WHO that actually takes a clear and objective look at lockdowns. They can cite some confounded garbage that they've been churning out, which is more akin to propaganda, not science, but they did not actually implement a lockdown in a way that it can be studied and isolate the effect of the lockdown. And to understand why, you could go and see a video I did about Chirag Patel's very excellent work. That's point number one. They advocated for something that certainly had a huge impact on the global poor, the countries that WHO supposedly cares about, India and sub-Saharan Africa, and that cannot possibly have a benefit in places like the United States, prima facie, because it didn't really change on average decisions. It did probably punish people for exceptional decisions, which is why it was an incredibly perverse policy. Number two, masking kids. The WHO, they're not as crazy as the US people, the AAP and the CDC, but they are not a science-based organization. Here's what they write. Quote, in areas where SARS-CoV-2 is spreading, children ages 6 to 11 are recommended to wearing a well-fitted mask. Children under 5 do not need to wear a mask because in this age group, they may not be able to mask properly. That's what they say. So, they weren't as crazy as the US, but where is the evidence that a 6-year-old should wear a mask, WHO? Did you conduct any studies in Geneva? Did you organize and participate in any cluster randomized trials in Geneva? Or in any of the regions you work in? No, you didn't, WHO. You actually didn't have any studies on that topic. So why are we giving you $1 billion for you to just come up with an opinion? My opinion is it works for 9-year-olds. Actually, no, maybe 11-year-olds. Actually, it's 3 years old. Actually, it's 4. If you're just pulling opinions from your asshole, why do we need to fund you? Why should the US be paying for you to give an opinion without actually conducting any studies? That's the point. Number 3. WHO writes, quote, governments must make the most of the extra time granted by lockdown measures. Again, they didn't have any evidence that there was extra time granted. By, quote, doing all they can to build their capacities to detect, isolate, test, and care for all cases, trace and quarantine all contacts, engage, empower, and enable populations, blah, 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 that kind of rhetoric. Test, trace, and isolate was a popular slogan in 2020. To date, we have no robust empirical evidence that that strategy was feasible, practical, or could do any good in a place like the United States. Now, if you live on an island nation, there's only 25 people and nobody has COVID, you can probably test everyone on entry, like New Zealand. But in the United States, where you had so many seed events, you could not use test, trace, and isolate at all. This virus has too many people who have asymptomatic carriage. This virus has often a prolonged incubation period. This virus spreads much more than you can capture with test, trace, isolate. We made testing companies rich, but to date, not a single company, not the WHO, not anyone, has shown under what conditions test, trace, isolate can actually curtail the spread of a virus. They've never done the science to back up their recommendation. They, again, pulled it out of their ass. Number 4, WHO. They repeatedly lied about vaccination. This is WHO, quote, to safely achieve herd immunity against COVID-19, a substantial proportion of the population would need to be vaccinated, lowering the overall amount of virus able to spread in the whole population, end quote. That is a complete lie. We know that you can get 1,000 shots and you're still going to get COVID-19. But why did WHO lie? You could say they did the best with what they had at the time. But here's the key. We're giving them $1 billion. Could they have generated better evidence? The answer is yes. In a number of global randomized controlled trials for vaccine, the WHO could have paid to run a subset study where you pick 1,000 people in both arms and you swab their family members and contacts. That way you would test whether or not the vaccine actually prevented spread in those households. That's 1. 2, the WHO could have run studies as the vaccine was rolled out in 2021, testing transmission. They repeatedly failed to do so. And in fact, by the summer of 2021, we knew that it could not. And WHO continued to offer that lie, I think, in many TV interviews. WHO, my precise qualm with them is not that they were wrong. It's that they take all this money and they're pretending they're giving you a science-based recommendation, but they're not actually conducting any empirical studies to make that claim stronger. They're not testing their own claims. And somebody put it to me quite plainly. The WHO cannot run a randomized trial of masking 6-year-olds or 5-year-olds because if they're wrong, they'll look like buffoons. So we have an organization, and I think that's true, we have an organization that wants to make recommendations and actively wants to prevent people from assessing their recommendations. And then they want to do retrospective, analytic, chart review, blah, 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 observational studies where they can hack the crap out of it to support their prima facie notions. That's not really science. That's more akin to propaganda. So back to Trump. Now, many of the WHO positions directly subverted Trump's intuition and Trump's decision-making in 2020. The WHO's positions actually, very likely, cost him the 2020 election because he disagreed with masking kids, for instance. He probably didn't give a shit, and he probably didn't give a shit about masking in general because he never wore a mask. Okay, I think that he happened to be correct on both those points. The evidence does not support those kinds of strategies, and now we have lots of studies. But even back then, I thought the available evidence from the Cochrane Review was pretty negative. But the WHO took the opposite stance, which hurt his political prospects. So why should the United States pay for a third party to issue recommendations for health emergencies that are not based in science and that are inherently partisan, that support the policy preferences of the Democratic Party, but not the Republican Party? The United States shouldn't do that. The next issue, I think, of course, is sovereignty. The United States actually hands over authority to declare pandemic emergencies to the WHO, to Tedros, from our sovereign nation. The United States cannot be beholden to a third party over our own sovereignty. So for these two reasons, I think the United States, the fact that WHO screwed up so badly, the fact that I think they're increasingly partisan, and we have to be honest, public health types are partisan. They tend to be of one political spectrum. There are many, many studies that document their voting habits, their political persuasions. They also tended to have personal practices that were far beyond what average people were doing. They were the people still wiping down their bags. They're still the people wearing the N95s in the airport because they've lost their mind. They're out of touch with the mainstream Americans. They're out of touch, I think, with the mainstream person in the globe. They claim to care about the global poor, but no one has done more damage to the global poor than these public health nitwits for recommending lockdown and school closure. Those two nitwit ideas did more damage to the global poor than anything they've ever accomplished in the last 50 years. They'll never make up for that damage. They're not competent. They're partisan. They're not competent. We're paying them a lot of money. They're taking away our sovereignty. What is the case to fund them? We should withdraw from WHO. We have our own CDC, which is also screwed up, but at least it's ours and we can try to fix it and make it better. We can install our own director of the CDC and try to reform it from within. But why should we continue to participate in WHO? I see no reason to, and I certainly don't see why Trump would want to when they've actively thwarted, I think, his 2020 campaign. Now he has an opportunity, I think, to correct that WHO has leaned too far in the political opinion direction and not in the science direction, and they need to be reprimanded for that. So I would withdraw from WHO on day one, of course, and I will be happy to defend the claim for anyone interested that is actually a wise medical decision. And again, the medical argument is, why are we paying billions of dollars for someone to give me opinions that they do not run any studies on for many, many years, and they do not know if that's the right opinion? That's not a science-based organization. We're supposed to be funding a science-based, politically neutral organization. That's not what they are. And so we should no longer fund them if they didn't want to adhere to their side of the bargain. Those are my thoughts on WHO. I'm going to be back with another video, I think, on Samoa, because I see a lot of people talking about it. If you like this video, here's what you got to do. Follow me on LinkedIn. Follow me on Instagram. Follow me on X. And subscribe to Vinay Prasad's Observations and Thoughts. That's the only way that you and I have a direct connection, that I get your email address. And all these other platforms are subject to the whims and fancies of whoever runs them. But Substack is the only thing where the actual author and the reader have a direct connection. So follow me there. Until next time.